Hello, everyone. Thank you all so much for joining us. Tonight, we will be continuing our discussion on men's health. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Welcome to Wellness Wednesday with Dr. Wells. As I always mention, I'm so grateful for each and every one of you for being here tonight. Thank you all for taking your time to be with me. As we continue our discussion in men's health, tonight we're going to talk about health screenings that each male should have each year. Last week, just to recap, we discussed top 5 health conditions that men deal with, right? And went into some detail about the importance of those things, what they mean, how you could be screened for them, what puts you at risk for certain things. And so tonight we're going to talk about health screenings. Health screenings are so important. It's definitely important for you. Each and every individual, male, female, should receive a physical exam every single year. And as a part of that physical exam, there are certain things that should be done, and it's a standard for each exam that you have. Okay, so every year, men between the ages of 18 and 39, and then we have some things that are specific for older individuals, older male patients as well. But tonight we're just going to discuss the broad spectrum of the age range, right? From 18 and up, health screenings that you should receive, okay? And again, just want to put this disclaimer out there that the information that I'm talking about is one based on my personal and professional experience and knowledge, as well as information that I've received through my education and research and continuing education and things of that nature. So I always encourage anyone who I talk with your healthcare provider about these things, right? I can give you some information. Your healthcare provider may tell you something different. It's up to you to take charge of your health. It's up to you to advocate for yourself as it relates to your health. And so take this information that I'm providing for you, write it down, have that discussion with your healthcare provider, because at the end of the day, we all want to make sure that you are getting the best care and that you're taking care of yourself to the best of your ability. In order to do that, you have to be educated. So tonight we're going to discuss some things. And I always like to have my notes. So every year, as I mentioned, we all should be getting a physical exam. That includes a full head to toe assessment where you're going in there, you're taking off your clothes. They may give you the little paper, gown or the cloth gown. But in order to get a good assessment, as a healthcare provider, I need to see your skin. I need to look at your skin, make sure you don't have any rashes, any open areas. Looking at a patient's skin can tell us so much, right? So that's the first part. If you're going in for your full physical exam and they're doing that exam with you completely clothed, and in some instances, that's what's most appropriate, right? But at least they should be pulling up the shirt, listening to your heart with the stethoscope on your skin, looking at your skin, listening to your lungs, things of that nature, right? Because a part of the assessment is assessing the skin. And so that's a little pet peeve of mine, going into a physical exam and you're not getting the full exam that you should. So I'm going to get off my soapbox when it comes to that, and we'll kind of dive into the topic for tonight. So as I mentioned, men 18 and up should be getting a physical exam. Everybody should get a physical exam every year, but this month we're focusing in on the men. And so why is it important that you get a physical exam and that health screenings that we're going to talk about? One, it screens you for medical issues. It assesses your risk for future medical problems. It encourages a healthy lifestyle. Make sure that you're updated on your vaccinations. And we're going to talk about the different vaccines as we go throughout this conversation tonight. And then it helps you to get to know your healthcare provider in the event that there's a illness or an emergency that you need to get in to see someone. I can't tell you how many times I've received phone calls, text messages, or I've talked to individuals who are in the midst of a acute healthcare issue, or they're sick and they can't get in to see a healthcare provider because they haven't established a relationship with someone. And so you're going in as a new patient, and right now the time frames of getting into a healthcare provider, the time is 3, 4 months, sometimes a year. So establishing that relationship with a healthcare provider is going to, one, ensure that you have access to that individual in the event that you have a medical situation where you need urgent care, as opposed to going to the emergency room. And again, there are some things that require you to go to the emergency room, but I'm seeing more and more individuals utilizing the emergency room as their primary care or doctor's office, and that shouldn't be the case. There are certain situations that require individuals to go to urgent care, and if that's appropriate, then go to the urgent care. But again, for your routine primary care needs, you should have a relationship with a healthcare provider in your local area. Some of the things that we want to make sure that you're getting screened for, right? Your blood pressure, we talked about that. The top number, and again, I did a talk this weekend and we talked about one of the questions that I talked about, one of the topics that I talked about was the blood pressure. I still stay with the 120/80 rule. That changed a couple years ago, where research came out and said, okay, we can consider a blood pressure that is 130/90 more than one time, like on a consistent basis. We can consider that to be hypertension. Well, I still like to go with that 120/80 rule. Okay. And it's hot in here. I got all these lights on. So we want to stick with that, right? So every year you want to go and get your blood pressure checked, just so you have your baseline. I'm going to adjust this one second. I'm sorry. I'm trying to turn some of these lights off. I'm sweating because of all these lights. But 120/80 is the number that I go by, right? One, having that baseline will determine if the blood pressure does increase, then you know that something's wrong. But if you come in and you haven't had your blood pressure checked and you don't know what your baseline is, then we have to kind of start from the beginning, right? The next thing is knowing your risk factors for high blood pressure. If you have family history of high blood pressure, then knowing your history will help us. Turn the fan on for me. Will help us to determine. Thank you. My daughter brought me. It's hot in here. I don't know why. I got all these lights. Can you turn one of those off for me? Yeah. Thank you. Having that history and knowing your family history and having that conversation with your healthcare provider will help you determine whether or not you're at risk for developing high blood pressure. Do you have diabetes? Do you have a family history of heart disease, kidney disease? What's your weight? So at your healthcare, that first visit, they're going to check your weight. They're going to get your height so they can tell you what your BMI is. And based on that will determine if you're at risk for developing certain conditions that are linked to obesity or excess weight. Want to go back about the blood pressure. One single reading of blood pressure doesn't necessarily mean that you have high blood pressure. That blood pressure needs to be taken on several different occasions, and those records, that number recorded. If it's elevated 3 consecutive times or 3 different times, then we can say, okay, this individual has hypertension and we need to do something about it, whether it be weight management, whether it be diet and exercise. Those are some things that can help in terms of a high blood pressure. Another thing that we want to take a look at is you should have some blood work done. The blood work is going to show us certain things. So your full physical exam is going to include the blood work. You may have an EKG done. For women, there should be a breast exam at the exam. Depending on the age of men, you should be getting your digital rectal exam to check your prostate. And again, we talked about this last week. Some men are so resistant to that. And for those who are resistant to it, and don't want to have it done, that's a conversation you need to have with your primary care provider. There is blood work that we can do to check your prostate, but that blood work is a little sensitive in terms of, it could be high because of certain activity, or it could be high because, you've exercised and things of that nature. So when you're having your physical exam done, we're going to do your blood pressure. We're going to get your height and your weight. You want to make sure that they're listening to your heart, that they're listening to your lungs. You have 2 lungs. We should be listening front and back. The right lung has 3 lobes, so we should be listening to each of those lobes. We should be listening to your belly. What does your belly sound like? What does it feel like? Is there any pain when we push down or palpate on your belly? What does your spine look like? What does it look like when you're walking? What are your reflexes, right? So these are all the things that should be checked when you're going in for your physical exam. Looking in your ears. Do you have any wax? Is there any redness? Is there any fluid? Anything out of the norm with the individual's ears? How is their hearing? We should be checking your hearing, getting your hearing checks each time you go for your physical exam. We're going to look in your eyes, check your eyes. Is there any abnormalities there when we look into your eyes? We want to check your strength, upper and lower. So we'll have you, grip my fingers as tight as you can, push and pull to make sure that your strength is equal. We don't want one side to be weaker than the other side. That could be signs and symptoms of a stroke or some type of spinal injury. We're going to check your feet. What's the sensation on your feet? So that in a nutshell, and there are some other things we can get a little more detailed with the physical exam, but those are important things that should be done with that physical exam. That's a part of your annual health screening. Blood pressure we mentioned. Next thing in terms of blood work is your cholesterol. So men age 45 and older who have no known risk of coronary artery disease, it should start at the age of 45. However, if you have a family history of heart disease, then your screening for cholesterol should begin a little earlier. And that's something that you're going to have a conversation with your healthcare provider about. For the men age 20 with known risk factor for coronary artery disease, then you're going to have your screenings done at age 20, right? Cholesterol should be repeated, and typically it's repeated every year when you go in for your visit. Some studies and some literature says every 5 years, but if it's elevated, it's something we want to monitor, right? And it should be something that's a part of your routine blood work each year that you go in for your health screening. And it's more often, again, if you have diabetes, you have heart disease, kidney disease, and certain other conditions. And especially if you have a family history of elevated cholesterol, your cholesterol levels will be checked more frequently. Again, we talked about diet, and next week we'll get into diet and exercise, and we'll talk about the rationale and some of the things that you can do for some of these screenings if we find there's any abnormalities. But tonight we're just going to focus on the screenings. For diabetes screening should begin at age 35 and repeated every 3 years. Again, some studies say differently. And so generally, when you go in for your blood work, there's going to be a glucose level that's checked. And I have a really good friend, Camille, who is a nurse practitioner, but she specializes in diabetes and glucose management. So one these times I'm going to get her on here so that we can kind of delve into diabetes a little bit more. But every year, your blood work should include a glucose level. And most of the time, you're going to be fasting, because with a cholesterol screening, you should be fasting, right? Nothing to eat 8 hours before, or 12 hours, depending, 8 to 12 hours, depending on which lab you go to, before you have this blood work done. And with the glucose level, that should already be included in your routine blood work. However, there's another test. It's called the A1C, or hemoglobin A1C. And what this test looks at is it looks at the blood sugars, the blood glucose levels for a 90-day period in the past. So it's going back and getting an average of the individual's blood sugars for 90 days. If that number is elevated above 6.5 or higher, then you are considered to be diabetic, right? So that should be included in your blood work. And if it is elevated, then that's going to lead to additional questions and conversation with you and your healthcare provider. If you have a first-degree relative with diabetes, or you are overweight or have obesity, and you have high blood pressure, again, that puts you at a higher rate, higher incidence or chance of developing diabetes. So the screening for diabetes is so important. Going to the dentist, that's something we should be doing every single year. I can't tell you how many individuals or patients that I have encountered who do not go to the dentist. Your dental health could impact your overall health. You know, if you have cavities, things of that nature, you have broken teeth, you can't chew properly, it's going to impact your overall health. And so every year we should be having a dental exam and cleaning at least 2 to 3 times a year. Your eye exam, you should be having your eyes checked at least every 1 year if you are diabetic. And for those who are not, the recommendations are every 2 years. As we age, some of us, as we age, we have to wear glasses. Our vision changes. And I'm one of those ones, but it wasn't because of aging. I started wearing glasses when I was like 25. So I'm not old, but my eye issues are not related to, the standard things that we see when individuals age. But it is important that we get our eyes checked once every 1 to 2 years, depending on your medical history. Some of the other screenings include vaccines, flu shot. So everybody during flu season should get a flu shot. And again, there's some controversy from different people who don't believe in vaccinations or don't believe in certain vaccination. And again, we're just giving you the information. It's up to you what you do with that information from there on out. So once a year, flu shot. The next thing is the tetanus and diphtheria, or DTaP. So should have one after the age of 19. You should receive that Tdap. And then it's every 10 years for the Tdap. Individuals, if you're out, you get cut, you are in the garden, you're injured, most of the time, if you don't know when you had your last tetanus, they're going to go ahead and give you that tetanus. And it's every 10 years, right? So the next one is the varicella, and that's the chickenpox. So we should receive at least 2 doses if you've never had chickenpox or varicella vaccine. For hepatitis B, should receive 2, 3, or 4 doses, depending on your circumstances, right? Many of us get these vaccines when we're children. In certain occupations, you're required to get them, but it's important for you to kind of follow those recommendations. And again, it's up to you what you do with that knowledge. So for the MMR, the measles, mumps, and rubella, there should be 1 to 2. And usually these are done when you're younger, right? So you get all of your childhood vaccinations, you should be up to date. And many times patients don't have those records, but you can go to your local health department. There's something in the state of Florida, it's called Florida Shots, and your healthcare provider can either pull it from there, or you can go to the health department and they should be able to pull your records regarding your vaccinations from there. It's important if you have that information, keep it in a safe place, because you're most likely going to need it later down the road. as we get into the older patients, the pneumonia vaccines and the shingles vaccines are something that we begin to talk about. So as you're old, adults who are 65 years or older may discuss whether or not they need to get that pneumonia vaccine. And it's, again, if you are younger and you have health issues, then your provider might recommend that you get the pneumonia vaccine. Another thing that over the past maybe 10, 15 years, maybe even longer than that, is the HPV vaccine, the human papillomavirus. Originally, it was just for young girls that they were marketing it for, and studies showed that it was best for young girls to have the HPV. But as time went on, studies expanded, and it is required now for males. So not received in the past, then it's recommended that you get it. Okay. And it's a series of those vaccines. Other vaccines is the hepatitis C, to help you with prevention of developing hepatitis C at some point in your life. There is a certain age group or population of, and I believe it's the baby boomers, who, because of the era in which they were born and raised, were at a higher risk for developing hepatitis C. And so knowing these screenings, these vaccinations, recommendations will be very helpful for you. In terms of the physical exam, it's, again, screen for disease. It assesses your risk for further developing any conditions, making sure you're up to date on all of that. Some other screenings that are important are depression and anxiety screening. And we talked a little bit about this in Mental Health Awareness Month, and I talked a little bit about it last week. And there's some questions that your healthcare provider should ask you, and there's a minimum of 2. And based on your answers to those questions, you may have some additional questions asked. So please be open and honest and transparent with your healthcare provider, because if you're an individual who is in need of assistance, who needs help, there are resources that are made available for you. We're going to talk about depression and anxiety. What does your workload look like? Who do you live with? Do you feel safe in your environment? Are there any stressors? Like, what's your appetite? How are you eating? How often are you working out? What are you eating? Things of that nature. And again, diet plans may be discussed in terms of, if you have high cholesterol, your healthcare provider may be able to provide you with some information on choosing healthy diets. Alcohol and tobacco use, we're going to ask about that. Any drug use, whether former or current. Even with smoking, we want to know, if you were a former smoker, how many years did you smoke and how long did you stop smoking? Like, how long has it been since you quit smoking? Based on that, you may be at risk for developing lung cancer. And so additional screening and testing may be completed, such as a CT of the lungs, a CT of your chest, to kind of look at the inside of those lungs in your chest to make sure that there's nothing developing there. For men, we want to have a conversation about your testicular exam. Just like women have to examine their breasts, we want to make sure that we're having those conversations about testicular. Complete that testicular exam on yourself. Like, how do you check? Know your body. No one should know your body better than yourself, right? Unless you have a spouse, then your spouse may know your body a little bit more, or significant other. I put that out there, okay? But you should know your body. If something changes, you should be the first one to be able to pick up on that. So looking and feeling and touching body parts is what's going to help you when it comes to knowing if something is not right. Your skin self-exam. One thing that I have to have a conversation with my melanated patients about is we too can develop skin cancer. So making sure that you're looking at your skin. If you have someone in your family who can look at your back, and it should be taking place at least once a month. If you have a mole or an area on your skin where you're noticing some changes in that, it's important to know that. But if you're not looking and you're not observing your skin, if something changes, you're going to miss it. And I've seen young individuals dying from melanoma, which is one of the worst type of skin cancers there is because of lack of knowledge, right? So we too have to wear sunscreen, and that is a question that your healthcare provider should be asking you. Are you doing your skin exams? Are you looking at the back of, having someone look at your back, looking under the bottom of your feet? Skin cancer could come there as well, and we not know it. So I want to make sure that you all have this information and that you're doing these screenings, or at least getting someone to assist you with it. Okay. Looking at your nails, right? A lot of us go and get manicure and pedicures, and there are men who do as well. And so that nail technician may be able to pick up on some things with changes of your nails. And so it's important that you are following and adhering to these different screenings. Colon cancer, we talked about that. When it comes to, your risk for developing colon cancer, some men are at risk for developing breast cancer or carry that gene. And so there's specific screenings that need to take place with regards to that. I want to go back to colon cancer. So for men between the age of 45 and 75, I believe that's the new age range, they should be getting a colonoscopy every 10 years, a sigmoidoscopy every 5 years, Fit DNA or Cologuard, as we know on the new, in media, every 3 years. And then a fecal occult blood testing, or FOBT, should be done once a year. If you're between the age of 45, I believe it is, maybe 40 to 75. But I think it's 45. Don't quote me on it. I can't remember at this moment. But, and I should know that. But so these are the time frames when it comes to these different tests. So if you've had one of these tests and you're okay, you don't have any abnormalities, then your provider, your GI doctor, gastrointestinal provider, will tell you, okay, these are your risk factors. This is what we found. This is when you need to be rescreened. Follow that, right? And we talked about all the signs and symptoms of colon cancer when we talked about colon cancer during Colon Cancer Awareness Month. But if you have any questions, if you're noticing that there's some changes, or you're just not sure, reach out. I'm available. I don't mind talking to you. Make sure you get in to see someone. But if you're noticing changes in any of these areas, reach out. If you don't have a healthcare provider, I can help you. If you need a new healthcare provider, let's have that conversation, okay? So in general, those are some of the most common screenings. We talked about the lung cancer screening. There's an age range for that for the CT, and it's between the ages of 55 and 80 who are current smoke per year history, meaning you smoke 30 packs of cigarettes per year, currently or in the past. Okay. That's pretty much it for all the screenings. And I'm sure there are some additional screenings, but I just kind of want to go over the most common ones. And if you have any questions about any of these screenings, anything that I've talked about, and you want more information, please let me know. It's so important that we get you screened. We get you screened early. And the best way to do that is for you to have your physical exam each and every year. Okay. So I'm going to go ahead and close for tonight. I just want to say thank you all so much for being here and joining the live. I'm on 2 devices, so I have Facebook Live and Instagram Live going. So thank you all so much. It is a pleasure to come on here each and every Wednesday to help you guys create your own legacy of good health. That's our mission here with Wells Legacy Health and Wellness, to help our family, our patients, and our community create a legacy of good health. And if it means that I can touch one person, or I can make a change in one person's life by doing these lives, then that's more than enough for me. I do have an amazing announcement. I'm going to tease you a little bit. I can't give it to you all just yet, but we are expanding, more information to come. And I'm just so excited when I'm able to share that good news with you all. Thank you all so much. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Stay safe and be well. Until next time, we will see you here again. Next week, you will get a pre-recorded message because we will be on vacation. So you won't see my face live, but there will be a recording on our next topic, which is diet and exercise in the male population. Take care again. Have a great evening. Good night.